Welcome back to the San Diego Spotlight, where we shine a light on business leaders around San Diego County and inform and empower you as a citizen of our lovely community. I'm your host, Elizabeth Story, bringing you the Inside Story. Today's guest helps make people all over the county look and feel better about themselves. He is a triple board certified plastic surgeon who has fantastic offerings for both men and women and the only man cave area in San Diego County. Introducing Dr. Richard Chaffoo from LaJollaHairMD.com and DrChaffoo.com. Doctor, welcome to our show.
Thank you, Elizabeth. Great to be here.
Glad to have you. And we've also been joined today in studio by a gentleman who is big around the studio and also a patient of Dr. Chaffoo, Mr. Mike Shepard, Program Director at ESPN and 1090. Welcome, Mike.
Hi, Elizabeth. How are you?
Good. Nice
Good.
to have you.
Thank you.
It reminds me of that commercial, I am not only the doctor, but I'm also a patient. So before we get into all the particulars of Dr. Chaffoo's practice, I'd like to let our listeners know a little bit about you. Where are you from, and can you explain to us what being triple board certified means?
Sure. Well, Elizabeth, I'm probably like a lot of people in San Diego, not originally from San Diego. I grew up in North Carolina and came out here many years ago. My background in plastic surgery actually is an unusual background. Many people that go into plastic surgery start out in general surgery and then ultimately go into plastic surgery as their second specialty. I actually started my training initially in otolaryngology or head and neck surgery. So I finished a 5-year residency with that. Then I obtained my board certification in head and neck surgery. Following that, then I went to Stanford, did a 1-year fellowship in facial plastic surgery, took my board certification in facial plastic surgery, and then decided didn't have enough schooling, so I thought I'd go back to a few more years of training in plastic and reconstructive surgery, and then obtained certification by the American Board of Plastic Surgery. So there is my 3 or triple board certification.
Wow, that's very impressive. I mean, when you're dealing with this kind of something that's going to be seen for the rest of your life, you want someone like you who is very well credentialed and very well certified.
I think it makes a difference for patients, and I always tell them it's always good to look and do your homework.
Absolutely. You've also earned some other top honors. You've been recognized for 5 consecutive years as one of the nation's top doctors by Castle Connolly, which is by your colleagues. You have also been selected by as a top doctor by U.S. News and World Report, and you've also been named the Patient's Choice Award for 5 years in a row. That's amazing.
I'm very, very lucky, very, very fortunate to have that.
All right, so now I want to kind of get into this man cave and hair restoration and talk a little bit about also Mike's experience. Can you tell us what is the man cave all about?
Well, the man cave is a concept that I'd heard about for a long time, that you'll hear on sports programs and guys talk about it. And a large part of our practice traditionally in plastic surgery has always involved women. About 80 to 90% of patients that we end up seeing are women, and maybe 10% or 15% are men. The great part about my practice is we have a very strong hair restoration practice, and actually a much larger percentage, I'd say probably 30% of our patients are now men. And so we really wanted that experience to be something unique and special for men coming in, because men aren't used to going into a plastic surgery practice unless they are going there escorting their wife or their girlfriend, some other significant other, right? So we decided to put together a space which men would really enjoy. So we have a large flat screen TV where you can see ESPN or whatever you want to watch, any sports shows. We have Wi-Fi, iPads, so they can surf the web, and we've got a special dedicated room with paneled doors and panel cabinets, huge window, nice space, and my staff all really kind of pamper the guy. So you're sort of king for a day when you come there. It's one patient a day. We really like to focus on quality, and I think the only thing is a lot of the guys are sorry to see the day end.
I was going to say, do you have to kick anybody out?
Almost.
I just want to go there and hang out for the day.
Exactly.
All right, now tell us a little bit about hair restoration. I know it's changed dramatically over the years, and it's a lot easier now. So I'd like to hear from you and also Mike about the experience for new clients.
Sure. So Elizabeth, hair restoration is something that the public knows about, but unfortunately knows about maybe in a negative way, because we've all seen people that have had the hair transplant technique where they used to put these, stacks or plugs or groups of hairs that were then separated by bald scalp. And so you could tell someone that had a hair transplant from across a room. And so a lot of guys would say, you know what, I just decided to lose my hair than look like that,
Right.
which we could understand. And then the other issue was that a lot of the older techniques would create a scar on the back of the head that you would be numb in that area sometimes permanently. The hair would thin out, would affect the kind of hairstyle you wear. And a lot of the guys that are athletes, military, and even the contemporary hairstyles today tend to have a shorter hair in the back. And so for a lot of guys, hair restoration wasn't an option because that was a big concern for them, and rightly so. So what we've done with our hair restoration organization is we've brought a system that's relatively new into the area called NeoGraft. And NeoGraft is essentially a device that was developed originally in Europe and then brought over to the United States, has FDA approval. And the advantage to that, Elizabeth, is that there is no donor scar. There are no sutures, no staples in the back of the head whatsoever. And then the grafts are placed individually from anywhere from a single hair at the very front of the hairline to 2 or 3 hairs further back. And essentially we recreate hair the way you lost it initially. So you could be up close to somebody that's had hair surgery. They could step out of a hot tub or out of a pool and have their hair combed back, and it's their hair. It wouldn't look like they'd had surgery done. So it looks completely natural, and it's really opened up the opportunity for men everywhere. And we do see some women, of course, that suffer from hair loss, but of course the majority are men.
Yeah, I had the opportunity to get on your website and review some before and after pictures, and it looks incredibly natural. I mean, you literally cannot tell at all. It's really great. So Mike, you commented when you came in the studio about how easy it was. It's easier than going to the dentist. Can you tell us about your experience?
Absolutely. It was a great experience for me. I'd looked at hair restoration over the years and looked at a variety of things. Of course, the potions that were supposed to work that didn't. I combed my hair over. I trimmed it down. I did all sorts of things. And I looked at traditional hair restoration and what it looked like to me, what people went through for that, what guys went through for that. I just said, for that result and that pain, there's just no question. I didn't want to do it. The trade-off wasn't there. Then I found out about NeoGraft and Dr. Chaffoo, and I went in. And you're right, you get pampered for the day. It was a great day for me. As I was telling Dr. Chaffoo earlier that one of the things I really liked was the fact that we just hung out. We told stories, we told jokes. I watched movies. I had lunch, took a nap. I mean, it was really a very not only painless. It was pampered. I was at the spa for a day, so it was really a great experience. And I was done in one day, one afternoon.
Oh, how fun. I have a feeling husbands all over the world are going to be escaping their wives soon, sometime this week or next week, and coming into your office.
I want a man cave like that at home. That's what I want.
Oh, I can't wait. I want to go check it out, too. Can it be a woman cave sometimes?
Well, I don't know. We'll have to ask the guys. There's a dog house, and that's just for guys. So there's something on the positive side, I guess, for guys as well.
All right. Now, I want to know, so you mentioned that the procedure itself only takes a day. So how long does it last, and how long does it take for the hair to start growing in?
So great question, Elizabeth. So essentially, when you do the transplant, the grafts are put in that day, and then what normally will happen in most patients is there's a little stubble of hair that's part of the transplant, and that may grow for about a month. Then invariably it'll fall out after that time, and then it will begin to grow at about 3 months. It takes about a year to 15 months to see the final outcome because hairs in any random square centimeter in the scalp are in 3 different phases of growth. They may be in a growth phase, they may be in a phase where they're falling out or a rest phase, and so they've all got to cycle together. So it's about a year process year to 15 months before you see the final outcome.
And then once it's grown in, it's forever?
And that's the amazing thing. That's one of the most amazing things about my plastic surgery practice is, we can as plastic surgeons turn back the hands of time, but we can't stop them. So we can do facial rejuvenation, get a great outcome for a patient, but we kind of know, in about 10 to 15 years, you may need to have a little something else done. with hair restoration surgery that's done properly in properly selected patients, the result is permanent. So once the hairs grow in, they're there forever.
Even if your wife stresses you out?
Even if your wife stresses, they might fall out temporarily, but the hairs should grow back afterwards.
Now, what is pre and post care like?
Well, it's very simple, and we've tried to keep it very simple and very basic. But the basic preoperative care my nurse will see our patients in a preoperative evaluation, and she'll go over instructions with them, the hair care, some medications that we'll have them start before the procedure that they continue afterwards. And then the aftercare is really pretty simple, and I can speak actually from a patient's perspective because I had my staff work on me about a year and a half ago, and I had a bald hair on the top of my head. I remember your name, Elizabeth, because one of my twins is Elizabeth, and I have a Catherine and Elizabeth, and I was playing with my Elizabeth on the floor, and I think her twin got jealous, and she snapped a picture with my phone of the bald spot on the top of my head and said, "Look, Dad, look at this bald spot you have." And then she'd text it to me every now and then to tweak me. And so I started looking in the mirrors a lot, and it really bothered me. It bothered me about how it looked and how I'd have to, brush my hair in a certain direction. And fortunately, we had NeoGraft, and so I had that procedure done. My experience as a patient was like Mike's. I mean, I kind of came in, had some Valium. My nurse said that I wouldn't shut up. She said, "It's kind of a cheap date. We don't want to do this again. We keep getting each other, kept talking, and he kept asking, 'Are you talking? Am I talking too much?' And, oh yeah, you're talking." So it was about half a day for me. And then after the procedure, there was a very light bandage that goes on. You go home that night. And then it was funny because for me, my wife had some tickets to go to some seminar, and she said, "Well, I really want to go to that seminar." I said, "Well, sure, I'll go drop you off." She said, No, you don't understand. You're coming with me." I'm like, "Well, wait a minute. I've got this dress." And she said, "You're in San Diego. Nobody really cares." So I went this little band around my head. I felt like one of those 60s hippies.
Yeah, you're a little rock star.
Rock star. And nobody really did notice. She was right. I mean, I think I was the only one that kind of noticed it.
Yeah.
But that dressing came off the next day. Very simple aftercare, very simple instructions for your hair care after the procedure. And like Mike said, because there aren't any sutures or staples, you don't have to worry about a wound getting infected or opening up. Discomfort far less. And the reason why I say that, Elizabeth, is we've had a number of patients that have had the older techniques of that strip technique done. They'll come in, they've heard about NeoGraft, they'll come and see us, and we'll tell them about the procedure. And they'll always say after they've done the procedure with us, when you told me it really wasn't going to hurt very much and it was a very easy recovery, I thought, sure, of course. And then they were amazed because what they were comparing hair restoration with was the older, outdated technology to the NeoGraft, and it literally is like night and day.
Right. And I mean, your hair looks amazing, and it's a huge testament to the quality of the product that you are the doctor and you are also the patient.
Right.
I mean, it's really nice to know that you can trust someone who actually has done it themselves. And like I said, you do have actually phenomenal hair, by the way.
Well, some of that I'm definitely blessed with.
Yeah.
It's very shiny.